Welcome to Evidence Mastery. We're just flooded with data these days, so how do you know what to trust? That's what we're tackling today. We're going to build your personal toolkit for critically appraising real-world evidence studies, and we're drawing our insights directly from a really definitive guide on the topic. And that guide is Real-World Evidence, Principles and Practice by Dr. Masood Tusi. Specifically, we're diving into Chapter 9, which is all about reading and critically appraising a study. Okay, so let's get right into it. So why is this so important right now? Well, real-world evidence, or RWE, it's everywhere. It's shaping everything from clinical guidelines to drug approvals. But here's the catch. Unlike those super tightly controlled trials, RWE can be a bit of a Wild West. There's no single gold standard, which means it's really on you, on us, to look past the headlines and figure out what's actually valid and what's just noise. So, how do we do that? Well, we're going to use a practical 10-point checklist. I want you to think of this as your investigator's toolkit, okay? It's designed to help you systematically interrogate any RWE study that comes across your desk. But let's be super clear about the goal here. This is not about slapping a letter grade on a study, like an A+ or a C-. No, it's about building a mental framework, a kind of scaffolding, if you will. It's a consistent way to ask the right questions so you can truly understand a study's strengths, its weaknesses, and ultimately what it's really worth. All right, first things first. Everything, and I mean everything, starts with the research question. Before you even think about the methods or the stats, just stop and ask yourself, is the core question they're asking actually clear? Can the data they chose even answer it? And maybe most importantly, so what? Does the answer to this question actually matter? Does it inform a real-world clinical or policy decision? Look, if this foundation is shaky, the whole study's going to crumble. Next up, you've got to follow the data. Where did it come from? A really trustworthy study will be totally transparent about its data sources. They'll openly talk about the known flaws, because let's be honest, no data set is perfect, and they'll clearly document how they pieced different data together. If you can't trace the data's origin story, you just can't fully trust the conclusion. Simple as that. And now for the big one in RWE, the elephant in the room, confounding. See, since patients aren't randomly assigned to treatments in the real world, a million other factors could be influencing the outcome. A truly rigorous study tackles this head-on. It identifies potential confounders right up front, it explains exactly how they were controlled for, and then, and this is key, it pressure tests those assumptions with something called sensitivity analyses. Honestly, this is where a lot of studies fall short. Okay, so we've got our toolkit. Now let's take it out into the field. We're going on the hunt for common red flags, those little warning signs that tell an experienced reader, hey, maybe you should dig a little deeper here. We're going to focus on three big ones. First, something called outcome switching. That's when they change the goalposts after the game has started. Second, getting totally dazzled by statistics that don't really mean much in the real world. And third, when they're just plain vague about where the data came from. Let's take a real-world example of outcome switching. Imagine a study on a new heart medication. The original plan was to measure something very specific, hospitalizations for heart failure. But when the final paper comes out, they report on a much broader outcome, like all cardiovascular events. Now, why does this matter? Well, because by changing the target after the fact, they could make the drug's benefit look way bigger than it actually is. It's a classic move. Okay, red flag number 2, getting mesmerized by the stats. You see a headline that boasts a significant risk reduction with a teeny tiny p-value. It looks impressive. But when you dig into the details, you find out the actual change in risk is like a fraction of a percent over 5 years. So is it statistically significant? Sure. But is it clinically meaningful? Is it going to change how you treat patients? Probably not. It's such a powerful reminder to always look beyond the p-value. And our third red flag is what we call data opacity. Let's say a study claims comprehensive European coverage. Wow, sounds impressive, right? But then you find out it only included 3 countries. And even worse, it was missing data from the specialty pharmacies that dispensed a lot of the drugs being studied. That's not a minor detail. That's a critical flaw that could basically invalidate the whole conclusion. So, screening for red flags, that's just the first pass. Now we dive into the deep analysis. This is where we go beyond just spotting flaws and really start to interpret the real story the results are telling us. And the heart of this analysis really comes down to one key distinction: statistical significance versus clinical relevance. See, statistical significance just means a result probably isn't due to random chance, but clinical relevance, that asks the real question: is this effect big enough to actually change how we practice medicine? Let's make this real with a case study. There was a major U.S. study on a new oral anticoagulant. It found the drug led to a 36% lower risk of a really serious type of bleeding in the brain compared to an older drug. I mean, a 36% lower risk? That sounds incredible, doesn't it? But let's translate that. To prevent just one of these bleeding events, you would need to treat about 370 patients with the new drug for a whole year. This is what's called the number needed to treat, or NNT. And all of a sudden, that 36% lower risk gets put into a very different and much more practical perspective. But a deep interpretation goes even further. We also have to ask, does this effect hold true for everyone, or does it change in different subgroups of people? That's something called effect modification. And then you have to look at the confidence intervals. They reveal the true range of plausible effects and tell us just how much uncertainty we're really dealing with. Okay, so this all leads to the final step, the verdict. After you've assessed the question, screened for red flags, and interpreted the results, it's time to bring it all together and make a final, actionable judgment. And here's the reality. No study is perfect. Not one. The key is to make a reasoned judgment, right? You have to weigh how well the study was done, its methodological rigor, against how useful it is for the specific decision you need to make. The bottom line question is this good enough to act on? And that judgment really depends on who you are. Regulators like the FDA, they look at the totality of evidence, combining RWE with lots of other data. Guideline committees, they use RWE to fill in the gaps that clinical trials leave behind. And a hospital might take a study and reanalyze it with their own patient data to see if the findings even hold up in their local population. So, to help you put all this into practice, think of a simple summary sheet, something like this one. It forces you to rate your confidence in a study's core areas: the question and data, how it handled bias, and the ultimate relevance of its results. It's a simple but really powerful tool for your own appraisals. You know, ultimately, what this all comes down to is a single powerful idea. Mastering this skill isn't just some academic exercise. It's about being able to separate the true, meaningful signal from all the overwhelming noise of published research. Everything we've covered today gives you a great framework to get started. But if you want to truly master this subject, the definitive guide is Real-World Evidence, Principles and Practice by Dr. Masood Tusi. It provides all the comprehensive detail you need to really become an expert in this essential field. You can find it available right now on Amazon.com. Thanks so much for joining us on Evidence Mastery.